Whether you're trying to get pregnant naturally or through IVF, your egg quality will have a huge impact on how long it actually takes you to get pregnant. That's why today I want to bring you a special guest. Her name is Rebecca, and I want you to keep watching so that you can find out why she is such an expert on egg quality. Hi everyone, welcome to another episode of Fertility TV. I am Dr. Marc, Sklar, the Fertility Expert, and each week when we release a video, we talk about different topics. Today, we are talking about egg quality, and I have the honor and privilege of interviewing Rebecca Fett. Right here, Rebecca has written the book. I don't know if you guys can see it. Let's see right here. We'll zoom in. It starts with the egg. I'm sure many of you have heard about it. This is edition number 2. And which is why I'm bringing Rebecca on to talk to all of you, to talk to you about egg quality and the changes and tweaks and revisions that led to the second edition of this wonderful book. So Rebecca, thank you so much for joining me. I am really excited to have you here with me and to share your knowledge with everyone who's listening.
Thank you so much for having me. It's great to be here.
Yeah, so, I think the most important thing when we start, and if people don't know much about you, is for them to just get a little inside peek as to who you are and what brought you to write this awesome book and share this knowledge. So why don't we start there?
Sure. So my, fertility story really starts a little younger than most, with psoriatic arthritis in my teens. So because I had psoriatic arthritis, I had a lot of damage to my hips and spine. So, in my mid-20s, I was married, we wanted to start a family, but I was told pregnancy would be very, very dangerous. I would probably be bedridden the entire time and may or may not be able to walk afterwards because my hip joints dislocate. Yeah. So we decided on surrogacy with that context. And we went with a surrogacy agency in Texas, and we were matched to this just extraordinary surrogate. And then I figured, okay, it will be easy from here on out. We'll just go through an IVF cycle, get some embryos, do a transfer, and it should be easy. I'm in my mid-20s, no reason to expect I'm going to have any trouble with IVF. But we were in for a little bit of a rude awakening because I found out I had diminished ovarian reserve. So I had very low AMH, very low follicle count on the baseline ultrasound. And I think the chances they gave me of conceiving with my own eggs were around 5%.
Wow. Okay.
This just came out of nowhere, complete shock. And so I kind of, at that point, put my scientific training to work. I have a degree in molecular biology and biochemistry. And I spent the previous, many years reading scientific papers and writing about science for my job as a patent lawyer. So I kind of dove into all the scientific research and tried to find out everything I possibly could about what causes diminished ovarian reserve, what you can do to address it, how you can improve egg quality. I just sort of dove into the research in as much detail as I possibly could, spent many months reading every study, and I kind of came up with a plan for myself. And it was sort of 3 general components. The first being reducing exposure to certain toxins like BPA and phthalates, which have been shown to disrupt hormones. And, it wasn't the cause of my problems, but I wanted to do everything I could, have the best possible chance. The second element was diet. And so there are quite a few studies now showing that very high carbohydrate diets, and particularly high refined carbohydrate diets, can compromise egg quality as well as causing some hormonal disruption. So I reduced my carbohydrate intake a little. I don't think it's necessary to go particularly crazy. I'm not a proponent of the keto diet for fertility for most people. But in my case, I just cut back a little, and I was already following a very anti-inflammatory diet for my autoimmune issues. And I think it's now actually a lot more research showing that that's the right way to go into diet. There's all these new studies showing Mediterranean is where it's at. And I actually have another book about Mediterranean diet for autoimmunity. So that's my whole diet philosophy. But then the third piece of sort of my program for myself was supplements. And so this is really sort of the heart of the book, I suppose. I cover all 3 elements, but I think what most people come to the book for is they really want to know what the evidence is for all these various supplements for egg quality. And so I sort of laid out what do the studies show, what is supported by the research, what is not supported by the research. And then I, for myself, decided what to take. And I took ubiquinol, which is a form of CoQ10, and I chose to take DHEA, which stands for dehydroepiandrosterone, and that's a precursor for hormones such as mostly testosterone, but some others, and that's produced, everyone produces it all the time. Those with autoimmune conditions often actually produce less of it, and that's because autoimmunity can compromise adrenal function.
Right.
And that was probably what was going on with me. So I took DHEA and some other supplements. And then at the end of all of this, after a few months of giving myself a chance to improve my egg quality and potentially address some of the causes of diminished ovarian reserve, then we got started with the IVF cycle. And, that's always a bit scary for everybody. But when you go into that, after a couple months earlier, someone telling you it's not going to work, you are, it's too late at age 27, your time has passed.
Yeah.
It was anxiety provoking, but at the baseline ultrasound for that round, I had 20 follicles developing. So
fantastic.
Yeah, it was a huge change. And we went through, we did all stim medication, went through the egg retrieval, and I think 21 eggs were retrieved. Out of that, 19 fertilized. And this is the crazy part. Out of 19 fertilized, you might end up with, let's say, 5 or 6 good blastocysts at the end. We ended up with 19 good quality blastocysts.
How awesome.
Yeah. And so we very easily set a clinic record for the number of blastocysts from a single cycle. We had a freezer full of them. And if you see, these are my 2 little sons from the same.
I can see them.
They're born 2.5 years apart, but one of them was frozen at that time. So they're kind of twins. It's funny seeing my little 3-year-old running around thinking that he was in the freezer for 2 years. Yeah.
That's always a funny thought to have in the back of your mind as you see them, playing around.
So then after that, I thought there has to be other people in my shoes, other people who've gone through this, who are facing the same difficulties. I wanted to sort of give them all the information, basically share all my research, share all the studies so that it can help other people too. So I did actually another deep dive into the research again, just to make sure I was getting all the information that could be relevant to other situations like PCOS and endometriosis, other conditions that I didn't have, but have very much affect egg quality. Mm-hmm. So then I collected all the research into the book, and that's how it came about. And that was a few years ago now. And so as the research has been coming out with sort of more interesting things I wanted to share with people, that's what led me to update the book and the second edition, which came out, I think, last week or the week before.
Great.
And then, the other main sort of objective of the book, of updating the book, was first of all to share all the studies that came out since the first edition. But second of all, I just wanted to answer some of the common questions I get from people. And so get all the information there in the book in the first place and try to kind of cover all the bases and cover everybody's questions as best I can.
That's great. I'm sure you continue to get plenty of questions even now that maybe weren't even answered in the book.
Yes, there's always that moment where it goes to press and it's now too late to add anything else, and it's like, oh, also a question.
One more thing.
Right.
So one of the things that piqued my interest, and I marked it here. You've got a section. I'm actually going to make sure I read it right. Chapter 4 is unexpected obstacles to fertility. And I love this because so many of us have those unexpected obstacles. Can you talk to us about, I perused it, so I know what's in there, but can you talk to us about some of those unexpected obstacles? There's one that I want to kind of maybe dive into a little bit deeper, but why did you decide to have that section? And, let's share some of the bits that are in it.
Sure. So the chapter covers kind of 4 issues that a lot of people don't realize may be affecting their egg quality and fertility. So that's thyroid disease, celiac, vitamin D deficiency, and then dental problems, sort of dental inflammation. And the last one is probably less significant, but it just goes to the fact that, if you're not taking care of your dental health, that can cause inflammation throughout the body that surprisingly can compromise fertility. So that's just one thing kind of to keep in mind, just take care of. The thyroid part of it is probably the most significant because there's just so incredibly common for people to have thyroid autoimmunity, and it has a really big impact on fertility, particularly miscarriage. I personally know about a dozen people who have had hypothyroidism cause miscarriages. And there really has not been aggressive enough management of it in medical practice. I mean, there's so many women who are told, oh, your TSH is 4.5, you're fine, it shouldn't be a problem. But from a fertility standpoint, as you know, I'm sure you'll agree, we really want TSH lower. You really want to aggressively manage it because it brings down the miscarriage rate quite significantly. And it's often, you know, the obstacle that's stopping people from getting pregnant.
Yeah.
Then I guess the other big part of it is vitamin D. And that's something that's really becoming clear how important it is. So I think what most doctors consider an adequate vitamin D level is really not high enough for fertility. And so there's so many people getting tests and being told, oh, your vitamin D is fine, you don't need to supplement, when really they probably would have a better chance of conceiving if they did supplement. And there was a recent IVF study showing that women with higher vitamin D levels had a much higher chance of conceiving. I thought I had the number here with me, but I think it's somewhere on the order of 45% higher chance of getting pregnant after IVF when your vitamin D levels are adequate. And so that sort of brings us to what counts as adequate, and it's really higher than the standard measure. So the standard measure for vitamin D deficiency is often given as 20 nanograms per mil, and that was established many years ago as the bare minimum you need to preserve bone health. It's really not what you need to become pregnant and to stay pregnant. We really want at least 30, and probably it's more like 40. Looking at the studies. I don't know what your perspective is, Marc, on that and what you like to see in your patients.
I like to see around somewhere between 50 and 60.
Yeah.
Absolutely.
Actually, I mentioned that for those with autoimmune disease particularly, you want to be at least around that area.
Yeah, and I see a lot of patients with that, so that kind of tends to be my threshold. But yeah, you know, those points that you bring up in that section, you know, it's good because for a lot of people, those are the uncommon causes. But for me, they're very common.
Right.
Yeah, so vitamin D is a routine thing I check and adjust. Thyroid health, absolutely. It's such a big piece of what I do with patients. And I have a patient, so I just have to tell this story because it's so appropriate. She has a history of miscarriage. She came to see me and she was already pregnant her third time. She had miscarried twice before. And she was doing well. But I said, look, we've got to check all these things, you know, even though you're pregnant. So we checked her numbers and her TSH was 4.2 or something like that. And with her history, I was already concerned. So I said, we've got to send you back to your OB to have you put on medication. And her OB was rude and egotistical and just said, you're fine, you don't need it, on and on and on, and just made her feel like she was in the wrong. We ended up getting her the necessary medication. Her numbers came down, but when I retested her numbers just to make sure her TSH was okay, it actually happened because they had never been tested. I tested her antibodies and her antibodies were through the roof.
Yeah.
And I said, look, okay, so we're going to handle these things right now, but this is probably why you've miscarried in the past. And I'm really happy that we've been able to put you on your thyroid medication when we did, because I was, now I'm even more concerned that would have been an issue. So, but just goes to show you how often it gets pushed away and pushed aside and thinking that it's just fine. I like to see it somewhere between 1 and 2, your TSH. I think that's the sweet spot. And for everybody, it's a little bit different. And for some patients that, their number right now is 2.9, but they have all the symptoms of hypothyroidism just because their number, or just because, if you're listening, just because your number looks okay, but if you're having all these symptoms, that number might not be okay for you. And I think we get stuck in the medical system, gets stuck with just looking at these parameters and thinking everybody's okay as long as they fall into these numbers. And we're all different, we're all unique, and we need to be treated that way. So I'm happy you brought that up. Yeah. I think digestive issues get ignored all too often. So I was happy to see celiac in there. I think that's a big issue, just addressing celiac and all digestive issues when I work with patients for their fertility. So I loved seeing this section. So I was really happy you did that.
I think it goes to, knowledge is power in this game. When you're in the fertility world, you need to know as much as possible about what is going on with you and what the possible causes could be. And that's really often the way to success.
Yeah, absolutely. One piece, because it's a question I get all the time when it comes to supplementation, and you brought up CoQ10 and you brought up DHEA. In your research with DHEA, did they check DHEA levels in patients or did they just prescribe?
So that's a very interesting point. In most of the studies, they just prescribed it. There's been one more recently. So now the clinic that started all of this is CHR in New York, and now they do test patients. They generally recommend it either way, but they test in order to make sure they're having the right dose to bring testosterone up to the right level before they start the cycle. But going back to your question on the studies, there was a study showing that it works much better in people whose DHEAS, which is the sulfated version,
right.
When their DHEAS and their testosterone is on the lower side, sort of below average. It doesn't have to be deficient, just on the lower side, they are much more likely to benefit from supplementing. And for that reason, and also just to figure out whether DHEA is worthwhile for you, the book does sort of recommend getting testing done before you start taking it. And obviously this is a supplement to talk to your doctor about, not to just go off on your own and start taking, because it's a hormone precursor. It's not, a vitamin. You want to give it some thought and discuss it with your doctor. But really, it's a good idea to get tested before you start to see if your levels are a little low. Because if they're not, it may not help you. It probably won't help you.
Yeah, and for those of you who don't know, I think we tend to read and hear about supplements and think, oh, all supplements are safe, no problem. I'm just going to go ahead and start taking these things. In many countries, DHEA is actually prescribed and you can't get it. It's not over the counter. In some countries, like in England, it's actually very difficult to get because it is a precursor hormone. It has a lot of effects on the body, on hormones. And I've seen a lot of negative things happen with patients who take DHEA on their own and unmanaged. And so I just want to, just put out there to everyone, it is something that I do believe in should be tested. I tested in all patients before I prescribed for the very reason to determine if they should be on it and what dosage.
And then to monitor it over time, because the standard dose that's used in all of the studies is 75 milligrams per day.
It's high.
That's it's a little over what your body naturally produces itself. And so you're taking that for a few months, you're almost certainly going to end up over the level you.
Yeah.
So it's good to monitor it. And if you're going to be taking it for a while, probably you'll end up lowering the dose when you're monitoring it properly.
I agree. And it's something it's a good supplement. I love it. I think a lot of people like to take it as we age because it decreases over time as we age.
I still take a low dose of it to manage my inflammation, actually, because
that makes sense in your case. Yeah.
Yeah.
Yeah, it's a big. It is a hormone that's that is part of your adrenal cascade, and so often with autoimmune issues or even just dealing with fertility, we have a lot of adrenal issues and stress, and so it's definitely an important hormone, just one to be careful of and one to make sure it's being managed and prescribed by a provider. So
right, but then I think some people also are a little too cautious of it. I mean, of all the supplements in my book, it's probably the one that's going to make the most difference if you have diminished ovarian reserve, if you have low AMH. And some people get a little bit scared off it, but compared to all of the different hormones and things you're being injected with in the IVF cycle, I mean, it is a hormone, but it's in that same bag of all the things your doctor's prescribing for you. It's no than any of the other things your doctor's prescribing. It's something to take with your doctor's blessing and supervision, but it's not something to be scared of because it can be extremely effective. And the women who tell me their AMH has gone up and that they've had a massive change from one cycle to the next in terms of their follicle count, those people are almost always taking DHEA. It really does seem to make a huge difference for some people.
Yeah, I think for me, it's more a matter of dosage and length of time you're on it and so forth. But absolutely, I think it's an important piece to the egg quality conversation.
Right.
Yeah. So as we wrap up, and before we do, first I want to remind everyone, go to your nearest bookstore if you still have one in your neighborhood, or jump onto Amazon and pick up this great book. The research in here alone is worth reading, okay? Because most of us start supplements or start doing things and we don't really have the information and research behind it. And Rebecca's really put in the time and energy to compile all of that and put it in one resource for all of us. So I really, one, I appreciate that. And two, it should be a must read for you for that very reason alone. But two, it gives you some nice guidelines on how to follow and what to look for and your supplement take. So go ahead and check that out. We obviously didn't cover everything that's in the book in this conversation, but Rebecca, if there's one or two other points before we wrap up, what would those be? What would you like to share with everybody who's watching?
I guess just the fact that improvement is possible. I mean, so many women are getting bad news from their IVF clinics that they're being told, you're not going to conceive with your own eggs, you need to move to egg donation. And sometimes that is the right answer, but sometimes it's not. And you really kind of need to find out as much information as possible and give it a good try to see if you can improve your egg quality and quantity, because really it's possible, and some people have just tremendous improvement.
So I love that. I couldn't agree more. I think there's plenty of negative out there, and if we don't try to make those changes and see those improvements, I mean, if you didn't try to make those changes when you did,
right,
maybe those two beautiful babies behind you wouldn't even be around. So it's not to say that some of us don't need other interventions, but I think we would all regret it a little bit if we didn't make some changes and effort to see what we could do on our own. So, yeah, perfect. So go ahead and check out this book. We're going to leave links. If you're watching this on YouTube, in the description, we're going to leave links so you can find the book and find Rebecca if you'd like. Additionally, if you're watching this from my website, in the blog post below it, I'll have all that information as well for you. So Rebecca, thank you so much for taking your time for first and foremost writing these books, because that's really the key to everybody, to helping everyone out there, is compiling this information, but also just joining me today and sharing some of your information, allowing people to get to know you and meet you a little bit more personally through this video. So I appreciate that, and I hope that everybody watching appreciates it as well.
Well, thank you so much for having me and for those very kind words. I really appreciate it.
All right, everyone. So if you want to find Rebecca, click on those links below. Stay tuned for another episode of Fertility TV coming soon to a computer or phone near you. If you like this video, give us a thumbs up. If you're not already a subscriber to my YouTube channel so you can get notified when we post a new video, then go ahead and do that as well right now. And if you want to make sure that you get all my latest information straight into your inbox, then sign up for my newsletter, marcsklar.com/newsletter. All right, everyone. See you in the next episode. Bye-bye.
If you're watching this, you must be wanting to get pregnant. This is my gift to you, the Fertility Anti-Aging Manual, the ultimate guide for anyone trying to conceive over 35. This is the manual that's going to help you be even more fertile than you were in your 20s. Download the free Fertility Anti-Aging Guide now by going to the link below, or click here for direct access.